If the committee could come to order of the Health and Welfare Committee, the secretary will take a silent roll. Chairman Hyder is on state business right now, so he is not here now, and he may come later as we proceed. We'll continue on the agenda. John Hill, if you would step forward. Identify yourself.
Thank you, Mr. Chairman and distinguished members of this committee. My name is John Hill. I'm the Executive Director for the National Alliance for Medicaid and Education. I've been in conversations with Representative Daly for about the past year. Representative Daly contacted me regarding school-based services. The organization I work for is a national organization. Our board of directors is made up of primarily state education people and State Department of Medicaid folks, as well as a couple of school corporations from around the country. Our sole purpose of our organization is being able to better understand the federal reimbursement program and the state's reimbursement programs for Medicaid services that are delivered to students in public schools that are in special education. Our organization's mission is basically to advocate for the program integrity for the school-based Medicaid reimbursement. We basically have three areas of emphasis that we focus on. One of them is working with our federal partners at the Centers for Medicare and Medicaid Services in Washington, D.C., as well as the U.S. Department of Education. These are the two programs at the national level that basically that provide the oversight for the programs. We also collaborate with our national partners within Washington, D.C. and around the country. Such organization as the National Directors of State Medicaid programs, as well as the National Association of Directors of Special Education and the American Association of School Administrators, just to name a few, but there are many others that are also involved in the Medicaid and schools program. We also provide and facilitate a learning network. We do an annual conference every year, as well as we hold topical calls that are available for our members and non-members around the country that are interested in looking at ways to expand and enhance their school-based Medicaid programs. And we also do informal information sharing sessions is basically what I'm doing here. And one of the things that Representative Daly asked me to come in was to share information with his colleagues like yourselves about what this program's been able to do around the country, some concerns that possibly within the state of Idaho that we're leaving approximately $20 to $40 million on the table of federal funding that could be accessed to pay for the services that you're currently utilizing state dollars and state tax dollars to pay for. We basically are an all-volunteer organization. This map gives you some indication of where our board of directors have come from. You can see over the past 12 or 13 years, we've been spread out pretty well across the nation. Most people that get involved in an organization who either wants to become a board member or one of our committees get there because they want to learn the program. This is about the only place you can go in the country where our sole focus is trying to figure out how to best work with the federal governments and the state agencies around the country on implementing a program that maximizes the federal return at the same time of minimizing audit exceptions that can occur within the program. I'm a founding member of the N.A.M.E organization, served as a past president, and also served as their governmental affairs liaison in Washington for approximately 10 years. I have over 30 years experience in working with the state of Indiana within their Department of Education for my past 15 years. And the 15 years prior to that, I worked within their Family and Social Services Administration and oversaw several different Medicaid programs in various positions, including as the State Director of Developmental Disabilities for a number of years. I'm speaking today based on those experiences I had in Indiana, based on the experience I've had in working with other states around the country, as well as our national partners. Each state has to make a decision, people like yourselves, from a policy perspective on how and if you want to participate in the school-based Medicaid program. At this point in time, all 50 states in the country participate at one degree or another, basically, and that is our interest in the program. The only interest I have in the program is that it's done correctly. Every state that participates in this program vitally needs it. Again, these are federal dollars that pays for federally mandated services. If you don't use the federal dollars, you have to provide the services anyway, which means your state dollars are paying for it. So we want to make sure that the program is being maximized to its full potential, but at the same time, not overreaching in that potential in order to avoid audit exceptions. Like it or not, and we all don't like the federal mandates, and we particularly don't like unfunded federal mandates. But under the IDEA Act, states and school districts have to meet those needs of those special education students. What we have to decide is how you're going to pay for it. The good news in the state of Idaho, your Medicaid reimbursement rate from the federal government is almost 72%. It's the second highest Medicaid reimbursement rate in the country, so that's a great advantage that you guys have here. What I see from the language that I've heard in talking to a number of the education folks from around your state, as well as with a couple of the representatives, is there's a feeling that there is not, while the state departments will tell you the programs are operating good and there are no problems, there may not be any problems other than what I would foresee as being a problem of leaving $20 to $40 million on the table that you're spending state tax dollars on that you don't have to. In the past, many schools and state agencies had some fear about the programs. They thought that maybe the program is too complicated for a school or non-medical provider to be involved with and having to deal with Medicaid. There was also the fear of federal paybacks, and there was also the fear that the federal government may come along and just basically ban the program and get rid of it. The program's been around since 1980, or 1990. So if you haven't been participating in the program, you've already missed out on 25 years of reimbursement. Again, the state of Idaho is participating, which is a good thing, but there's probably ways that and things that can be done that could enhance the amount of money that you receive from the federal government, and thus reducing the reliability on their state tax dollars, and allow those schools that are currently receiving those funds to use those funds for other things that they're having difficulty in finding the funding to do. One of the things that when I was working for the state of Indiana, when I went to work for the State Department of Education in the year 2000, both the state Medicaid agency and the state Department of Education were pretty hands-off on this program. There was rules and regulations set up within the state, but basically both agencies dissuaded schools from participating. They thought it was too complicated and all those other reasons. When the 2002 recession hit, our state budget agency got involved and basically sent an edict down to both the Medicaid agency and the State Department of Education agency that if they wanted more money for education, the only way they were going to get it from our state budget agency was if they were pulling down all the federal dollars they could be. And they knew that the schools weren't participating in the Medicaid program. Basically, the language they used, which I find really interesting because it's the same as what you could use here, is the state of Indiana was not going to use its blue and gold dollars, since that was our state colors, to pay for services that were mandated by the federal government, that there were red, white, and blue dollars, or federal dollars, available to pay for those same services. Not only did the budget agency mandate that, and believe me, they got those agency heads' attention because they knew what a nightmare the state budget agency could provide or be to those agencies if they weren't being cooperative. Not only did they listen, but the state budget agency then oversaw a committee for the next 3 years to look at ways to enhance and improve the program. This committee met on a monthly basis and included representatives from the State Department of Education, the Medicaid agencies, 3 school districts from around the country, rural, urban, and as well as a large and a suburban school. Also included a couple parent advocacy organizations, as well as the 4 billing agencies that would help the schools process those Medicaid claims. This was done in the belief that we needed to have a collaborative, transparent program that everybody bought into, and that clearly understood the purpose of the program was to maximize the federal reimbursement again in order to reduce the liability on state dollars. We went from collecting a whole $180,000 in 2000 in Medicaid for school-based billing to $8.5 million in 5 years. Basically because of this enhancement in the program, enabling schools, providing training, making sure everybody clearly understood what the rules were. The state felt an obligation to make sure that those schools were well-trained and understood how to access those Medicaid dollars. They just didn't create a manual or tell them to read the rules to go out and do it. Because in this case, if the schools failed to do it, the liability fell on the state, because the state then had to fund the services that were, again, could have been funded by the federal government if the schools were doing it appropriately. All public funding has responsibilities attached. And I'm using the word responsibilities to try to be politically correct, but we oftentimes refer to it as strings. And what are those strings? First of all, we have to deal with matching funds. You got to work with local and state administration of the program, as well as accurate reporting. The one thing that is vitally important here, these are already services that are mandated to be delivered. These are already services that have been delivered. All we're doing is seeking reimbursement after the fact. I was having breakfast with some folks yesterday morning here, and one of them kind of said, well, it's kind of like a rebate then. And I said, exactly, except this isn't a 20-cent rebate. This is a 70% rebate in your case. If you spend $10,000 of state funding for the service, the federal government can return $7,000 of that to you. That's a huge incentive. One of the questions that you need to answer is to what degree you want to go after this to be able to maximize the funding. Keep in mind that the IDEA, when it was passed over 40 years ago, the federal government made a commitment to provide up to 40% of the cost of educating special education students. Today, they provide 15%, not very close to the 40. It was one of the reasons why back in late 80s and early 1990, the federal government allowed schools to start accessing Medicaid. It was another attempt for them to allow federal government to contribute to that 40%. One of the things that has been a deterrent, and rightfully so, is that if people are going to access these federal Medicaid dollars, there are issues and requirements that have to be followed. And whenever an audit goes out and happens, there basically audit exceptions happen for three reasons. One's fraud, and that's one thing that we don't want to happen. It's one thing that we want to make sure doesn't happen. When it does, and keep in mind, fraud means that someone knowingly committed a wrongful or criminal deception for financial gain. They knew they were doing something wrong. They knew they billed for a service they didn't deliver. They knew they billed for a service that was delivered by somebody that wasn't credentialed appropriately to deliver the service and turn around and bill Medicaid. But the whole deal is they knew it. That's a big difference than somebody that's participating in the program, maybe doesn't clearly understand the rules, which they should, but maybe they don't, and they bill for something they shouldn't have billed. There's a big difference between those two distinctions. The third type of error that happens is just basically human error. I may have saw Bob on October the 10th and delivered maybe a speech service to him. I documented my notes that I saw him, what we were working on, how long I spent with him. I go to fill out the bill of claim form, and I write down October 9th rather than October 10th. I still put down everything I did, I just put down the wrong date. An auditor comes along later, sees that I billed on October 9th, wants to see the October 9th documentation for the service that was delivered, and it's not there because it didn't happen. It happened on the 10th, but it wasn't on the 9th. That's money that's got to be paid back. There was an error made, but it was human error. Very different than fraud, and very different from even the second time a type of occurrence that may happen. Those types of errors can be minimized through quality assurance checks, through training, through various means of automation, but they're still going to happen. I make mistakes occasionally. I've made a couple already today that I'm aware of. Errors happen. Idaho is one of two states that I'm aware of in the country that actually utilizes civil penalties against public school corporations when they're looking at audits. In Idaho, if a school is billing for services and it turns out that maybe they didn't clearly understand the rules and they bill for something they shouldn't have billed for, or for whatever reason, then of course that they have to pay the money back. And that's going to happen in any audit and should happen. In the state of Idaho, you take that, they pay back the money, and then on occasion and under some circumstances, the state also applies a civil penalty to the school corporation for making those billing errors. One of the system recommendation changes I would recommend is that you look very carefully on how you utilize that. If you got a school corporation that this happened to and they hadn't done it before, or it's another thing. I'm not sure why you'd want to do the civil penalty, because you're just transferring money from one public entity to another public entity, which is a cost in doing that, and there's no public gain. If it's a school that's been told, you've done this wrong, you need to do it right, the auditor comes around next time and it's still being done wrong, that's very different. That would be a very appropriate time to utilize civil penalties. The other case in this country, the other state that I know that utilizes civil penalties, that state utilizes it. The state auditors go out, they look at a school corporation, what they billed for, also what they didn't bill for. They'll notice that the school corporation had 9 special education students that received occupational therapy. These students were on Medicaid. The documentation is there, but the school didn't bill Medicaid. They didn't bill the federal government. In this state's case, that's when they find the school, because the school didn't do its due diligence in pulling down the federal dollars. Therefore, the state had to pick up the cost rather than the federal government. Decisions that you need to be making and looking at. If you decide that you want to expand the program, it's very important that there's investment from both agencies, from both the Department of Education and the Department of Medicaid. Both those agencies had to be fully invested in the program. When I worked at the State Department of Education, because of my experiences in working with Medicaid and some of my previous jobs with the state, I understood both languages. Education world language is very different than the medical world language that takes place in the Medicaid shop. A lot of times what I played was interpreter in between talking with the schools and the Medicaid agencies. We would go out and do joint training. The Medicaid agency would get up and explain something in their terms. I would then say, in your language, this is what it means. When they talk about a treatment plan, in our case, we're talking about an individual program plan. Very simple stuff like that. If you want all your stakeholders to know and understand the rules so they can operate the program with integrity, that's extremely important. It's important that this joint training takes place. It's important that not only the training takes place, but there's some evaluation on the training afterwards to make sure the audience understood what you were saying. Again, this is in the best interest of the state that this is done. It's important for everybody to be involved, understand the following issues, and these are issues where there have been audit exceptions everywhere around the country when they get looked at. There's issues around referrals for services. Who has the ability to refer a student for a service and who doesn't in order to get Medicaid reimbursement? Some states require only a physician can do it. The federal law allows physicians, a podiatrist, a psychiatrist, a dentist. It mentions a couple other practitioners that I can't even pronounce the word of what it is that they do, as well as other practitioners of the healing arts. The federal government doesn't define what other practitioners of the healing arts are. The states can do that. Things that you need to look at. The other issues that come up is around service authorizations. Most states around the country use the student's education plan basically as a prior authorization for the service. This plan was put together by the student's professional team to determine what their specific needs were. They look at what he needs, how much they need. It's not one individual that's looking at it and basically deciding what it is. It's the student's team that's looking at it. Practitioner credentials, medical necessity issues, and service documentations are other issues. If we're looking at expanding the program, I would highly recommend that you look at a couple of surrounding states of ways that they've done it. The state of Montana has greatly enhanced their mental health services that they're providing within their school systems under their education plans, and they're now billing Medicaid through this program for it. Arizona's got a great program. New Mexico, Colorado, Iowa, and Texas, all of these programs have undergone recent federal audits. Yes, there's been some issues. That's a great learning opportunity of things we don't want to do, but they have other things that work very well. Also, it's important to be aware, as your Medicaid people are very aware, Medicaid programs vary a whole lot from state to state. The federal government gives you lots of flexibility on how you want to do your program. The states tend to decide, okay, we're going to cover this much. Okay, that's fine. But you need to understand maybe you want to expand that a little bit. If it enables you to pull down additional federal funding, but then you got to weigh out, are there woodworking effects? Are you opening up to other issues? It's stuff that takes time, takes lots of study and a better understanding, but just because you can't do it now doesn't mean that it is something that you might want to change. Our world's different today than it was 30 years ago. The kids that are showing up in our school corporations today, that schools have to serve are very different than the students that were showing up 30 and 40 years ago. Kids that require one-on-one nursing 8 hours a day are in your public school system. How do you pay for that nurse? 40 years ago, that kid was never in school. The rate of autism is drastically increasing. Those needs for those students, those medical needs and treatment needs for those particular students is advancing and is becoming a bigger issue for schools to deal with. Medicaid just this past summer expanded the autism services that they would cover, including those autism services that were covered in schools. Does your state plan allow you to attract and pull down those additional Medicaid dollars, to cover those services? It would be something that you really probably need to look at. In closing, our federal and state regulations, as well as our society expectations, have forced schools to become medical providers. Like I said, 30 and 40 years ago, they weren't, but today they are. There are lots of kids in those schools programs that are receiving lots of medical services. The issue that you have at hand is how and who's going to pay for that. Are you going to use your state taxpayer dollars to do it, or are you going to use your federal dollars to do it? And thus relieves those state dollars that were going to those education services, either to be used for additional educational services or something else. Any questions? Then thank you, Mr. Chairman, for your time.
Thank you, John. Questions for John from the committee before I recognize the senators. I assume that there's some people from the state here. Did they want to maybe comment or answer questions? Okay. Go ahead and we'll do questions for John, and then we'll have someone from the state. Senator Tibbetts.
Thank you, Mr. Chairman. Excuse me. Thank you, Mr. Hill, for your presentation.
Thank you.
I'm just a little confused, and maybe you can help me. So what outcome, and I got 3 or 4 questions probably, what outcome are you hoping for as a result of your presentation to us today?
John?
Thank you very much for your question, Senator. I'm hoping that there's a better awareness of what the potential is that's out there. My organization, only interest our organization has, and the reason why I'm basically here, is we want to see this program run effectively. Again, every state in the country depends upon this program. It's important that it's run as effectively as possible and with the minimum audit exceptions as possible. I also, as a taxpayer, whether I live at this state or not, have an interest in why you're using local tax dollars if there's federal tax dollars available to pay for services.
Mr.
So
Chairman.
that would be one thing.
Go ahead, Senator Tibbetts.
Thank you, Mr. Chairman. And Mr. Hill, so help me understand the nature of the organization a little better. Who actually joined? You showed us a map that said these states have joined, these states
These
have.
states have joined.
Are there
Who
states
belongs-
that join? Are the individuals that join? And where does the funding come from? Can
Okay.
I join as an individual?
Okay, to answer your question,
John?
yes, Senator. Anybody can join. Again, our board of directors are made up of state education staff, as well as Department of Medicaid staff, as well as there's a number of school personnel around the country. Our membership are state members that work for the Department of Education around the country, state Medicaid agencies from around the country, school corporations from around the country. Some of those national and state organizations, like your State Association of Speech Therapists may belong, the National Association of Speech Therapists belong to our organization. And all your practitioners, your OTs and PTs and things like that, and individuals also join our organization. The National Governors Association was a member of our organization for a couple of years. They came to our conferences and periodically show up.
Mr. Chairman.
Senator Tibbetts can follow up.
So, Mr. Hill, help me understand why people in other states want to join this organization so that they can pay you to come to Idaho and tell us about a program that obviously our folks in Department of Health and Welfare are aware of, but you say that your interest is making sure that it's done right and that we know that there are federal dollars on the table that we may not be using. Why do they have an interest in having you come to Idaho to tell us about this?
Well, it was the people on, excuse me, I'm sorry. I'm going to get used to the protocol here for a minute. Beg my pardon, please. Yes, Senator. It was the folks of Idaho that invited me to come. It wasn't my organization that invited me to come. It was the state of Idaho. Our organization membership fees are $50 a person. The other money we make off the annual conference we host every year. That is the source of our income.
Okay, Mr. Chairman, a follow-up.
Go ahead, Senator Tibbetts.
Thank you, Mr. Chairman and Mr. Hill. And I know that you've had some contact with our Department of Health and Welfare, but it's been represented to me that your contact with them has been very minimal. why come make a presentation to this committee as opposed to talking with the folks in our Department of Health and Welfare?
John?
Thank you. Thank you, Senator and Chairman. I did have a conversation with the state Medicaid agency in August. I also have attempted to have a couple of conversations with the State Department of Education here and never got return phone calls. Our other membership of our organization are the local school corporations. It's those local school corporations that have been working with our organization and are concerned that they aren't getting the reimbursement that they are interested in getting. Last week, I made some attempts to contact the state Medicaid agency here, knowing that I've been invited to come. I had very short notice on this invitation. And unfortunately, and they did try to get contact with me. Art Evans and I traded voicemail back and forth, but he would call me when I was on the airplane, or I was in the airport, or I was in a meeting. He was very ill. I believe had the flu last week. It just didn't work out. And yes, we hope to have continued conversations with them.
Thank you, Mr. Chairman.
Thank you.
Mr. Chairman, I'm sorry, I do have another question.
Go ahead, Senator
Thank you,
Tibbetts.
Mr. Chairman, Mr. Hill. And excuse me, I hope you understand I'm not trying to be difficult. I just really want to understand the dynamic here. So you said that part of the reason you're here is on behalf of, I think you referred to them as local school corporations. That's not a term that I'm familiar with. Are there school districts within
Yes,
this
yes.
state that are concerned that at the state level, we're not doing enough with this program and they would like to see us take advantage of this federal program to a greater extent than we are? Is that what I'm hearing?
That would be correct.
John?
Yes, that would be correct.
Okay. Thank you, Mr. Chairman. I appreciate it.
And questions from the committee? That we had someone else that wanted to testify in this?
Thank you for your time.
Thank you, John. Go ahead.
Mr. Chairman, my name is Dave Taylor, and I'm a Deputy Director at the Department of Health and Welfare. And I just want to come up and extend an offer to the committee that the department would be more than willing to come and present to you as far as some of the history and the progress that we've really made in this area over the past year. Former Senator Getty engaged me last year in related to this process, and we've done a lot of effort, worked very closely with the Department of Education, and have a very, very good relationship with them. And we've made a lot of progress, and I'm very, very pleased as far as what we've been able to accomplish over the past year. So I just wanted the committee to be aware of that, and I'd be happy to ask any questions, or answer any questions you may have.
Senator Hagedorn?
Thank you, Mr. Chairman. Dave, that was one of the questions I was going to ask was, is this a health and welfare issue for our committee, or is this more of an education issue where we need to get the educators and that committee engaged with this program?
Dave?
Mr. Chairman, Senator Hagedorn, that's a good question. We work very closely with the Department of Education. I can't really speak for them. We do engage in a regularly scheduled, I believe it's quarterly meeting with them and with local school districts. There are like 7 school districts that are on this advisory type committee where we bring these issues and we talk about them and work out solutions. We've also assigned a person within Medicaid to be directly liaison with the school districts in order to do like desk reviews, training, that type of thing, in order to help them to comply with the Medicaid program. Because school districts are Medicaid providers. They have to sign that Medicaid provider agreement. And so when they sign it, that brings all the requirements that come along with that signature.
Okay, thank you.
Dave, I do have some questions. What does Medicaid expansion have to do with this program? Is it effective because we raise the level of those people that are eligible, or does it have no effect?
Mr. Chairman, from my limited knowledge and what I believe, and I'll answer, then I'll turn around and make sure if I get a thumbs up or a thumbs down from my support back here, is that population is already covered. It's not part of the GAP population. So they would already have Medicaid coverage for those kids that are involved in school.
Okay. Dave, what is a reimbursable item right now through this program? What are you reimbursing for?
Mr. Chairman, some of the services I know that we're doing is speech therapy would be a service that would do. I believe that physical therapy would be another one, and I might have Mr. Evans come up and answer that question better for me.
Thank you.
Thank you.
Would you identify yourself for the committee?
Yes, my name is Art Evans. I'm the Bureau Chief for Developmental Disability Services in the Division of Medicaid, Department of Health and Welfare. Currently, Idaho has 14 reimbursable services that schools can access. I'll run through them real quickly. We have behavioral intervention, behavioral consultation, psychosocial rehabilitation, psychotherapy, nursing services, personal care services, occupational therapy, physical therapy, speech therapy, interpretive services, transportation, attendant care, durable medical equipment, and evaluations, which would cover psych evals, developmental evals, eligibility evaluations, OT, PT, SLP evaluations, and functional behavioral assessments. And those are all reimbursable under our current program.
Art, so there's federal mandated requirements in these areas that we're talking about for reimbursement. Is it part of a state mandate? Where are the mandates coming from?
I want to be careful in addressing IDEA because that's not my area of expertise. IDEA, the Individuals with Disabilities Education Act, does require schools to provide a certain array of services regardless of where the funding comes from. Where Medicaid becomes involved is when a service that a school is providing that fits either, it may be an IDEA service, but it fits under Medicaid's current benefit plan. Those services are then reimbursable, just like if it was another insurance company. The school can submit claims for those and be reimbursed. And so the IDEA mandates are from the federal government. They're not state. And Medicaid is able to reimburse for many of those services if the school is a provider and does meets the requirements that are in Medicaid rule.
Okay, the $64 question, and that dealing with money, is what percent of the services that are being provided now are we getting reimbursement for?
The Medicaid match is around 70%, so schools are getting a 70% match. There are no state dollars that are offsetting that match, so the school is getting 70%.
They can get 70%, but how many of them are requesting that? What percent? Do you have any idea what percent are actually requesting and thereby receiving that?
Of 174 I'm sorry, Mr. Chairman, I'm missing
Yeah,
protocol.
I
I'll
got
chalk
you.
it up to my foggy brain today. Of the 174 school districts that we have in the state of Idaho, 120 of those billed last year. And our expenditure was $26.8 million.
Questions from the committee?
Mr. Chairman.
Senator Lee.
Thank you, Mr. Chairman. Mr. Evans. So I'm still trying to understand the 174 versus the 120. What dollars, in your opinion, is the state of Idaho leaving on the table that we're not accessing, and why do you think that's happening?
Art?
Mr. Chairman, Senator Lee, I've asked that question myself. Over a year ago, a group came to me and said we were leaving $30 million on the table. I have consistently asked over the last year, and maybe a little more than that, where is that money? Idaho, Medicaid has not been able to identify that. We believe we've worked hard to make sure that there are reimbursable services and we're maximizing those. I honestly don't know where that $30 million is. If someone can point that out to me and we're able to leverage that, we certainly would.
Senator Smith?
Thank you, Mr. Chairman. Excuse me. Are any of the kids eligible for CHIP benefits?
Art?
Mr. Chair, Senator Schmidt, yes. I had some numbers pulled. We have 202,000 children in the state of Idaho who qualify for some form of Medicaid. And that's from birth to 18. We have 300,000 children in our school system. We've estimated that 60% of the children in our school system are eligible for some form of Medicaid.
Thank you.
Any other questions from the committee? Thank you, Art.
Thank you.
John, did you want to conclude your remarks? Well, thank you for being here and your presentation. Is there anyone else from the audience that would like to comment on this issue? If not, that concludes our business from the committee. We are adjourned.